Good afternoon and welcome. On behalf of the Society of Certified Senior Advisors, thanks for joining us for this month's CSA webinar, the expansion of health-related supplemental benefits for Medicare Advantage. We have a great presentation for you today, and joining us is Jennifer Ramona. Jennifer Ramona is the National Director of Business Development at Homewatch CareGivers, LLC. Her expertise includes 15 years of operation and marketing management in supporting older adults and individuals with disabilities, including the development and rollout of the Neurorehabilitation and Cardiopulmonary Specialties for the nation's largest home health hospice provider. So Jennifer, thank you so much for joining us, and the floor is yours.
Thanks so much for having me. So as indicated, we'll be talking about the expansion of health-related supplemental benefits for Medicare Advantage. In earlier this year, the Center for Medicare and Medicaid Services, otherwise CMS, as part of their annual call letter, actually expanded the definition of the health-related supplemental benefits. In addition to that, as part of the Balanced Budget Act of 2018, there was also additional policy passed that incorporated components of the Chronic Care Act that will even further expand supplemental benefits for the chronically ill enrollees. So today we'll be covering what this will mean for you. So we look to understand how many seniors this may potentially impact, review the 2019 changes and what we understand so far, and what the guidelines are of what services will be covered, and that as much as they've provided, as well as understand the requirements for providers and plans to be able to demonstrate coverage of the coverage requirements. Also, we'll discuss the status of these supplemental benefits and whether or not how they might be offered into Medicare Advantage plans or MA plans, and the potential impact that the 2020 changes have in them being offered in 2019. It is important to note that the changes are for Medicare Advantage only, not for all of Medicare. So Medicare Advantage is when you have eligible Medicare beneficiaries that choose not to participate in original or traditional Medicare. Those terms are interchangeable in terms of original or traditional, and instead they select a Medicare Advantage plan. These Medicare Advantage plans are offered and managed through the Medicare Advantage organizations, or MAOs, which are all managed care organizations. So it's the privatization of Medicare. Your largest Medicare Advantage organizations are United, Humana, and Blue Cross Blue Shield, which also includes Anthem. And those three alone compose almost 60% of the plans. Medicare Advantage is known as Part C, and when a Medicare Advantage plan is offered, it must cover all of the benefits that were offered or are covered under Medicare Part A, Medicare Part B, and Medicare Part D of the original Medicare. But they can also then offer supplemental benefits. And traditionally, people have known those as things such as vision, dental, hearing, and fitness benefits. Medicare Advantage, in terms of the population that it covers, it's 33% of all Medicare beneficiaries, which equals about 19 million individuals just in 2017. And of that was covered in over 2,300 plans. And we know that they're in 2018, they're actually over 2,500 so far. The average beneficiary that's covered under Medicare Advantage will have 21 plans to select from. So there are lots of different options of what the plans are and those supplemental health benefits that they cover. And even though there's 21 on average, you could be in a market where there are none, such as Alaska, or you could have over 30 different plans to choose from. And that has a lot to do with density of population, services needed, and those type of things. And those 30 plus plans can be covered by, of course, 0 if you don't have any plans to offer, all the way up to 11 different Medicare Advantage organizations offering those array of plans. So you might have 30 plans and let's say 5 from Humana, 10 from United, a few from Blue Cross Blue Shield, and then some other more local. Medicare Advantage plans are by county, And so, but can be considered local, which is by county, or regional, which is going to cover multiple counties and usually multiple states. But again, there are over 2,300 in 2017. But the thing about Medicare Advantage is that based on the Congressional Budget Office in January of 2017, they anticipate Medicare Advantage enrollment to continue to expand. Like I said earlier, we're currently at 33%, and by 2027, they're anticipating that it will expand to at least 41%. So it obviously is a large population of seniors or elders that can potentially be impacted by these changes. So what happened with the change with the Center for Medicare and Medicaid Services with the 2019 calendar year call letter? So what happened is they changed the definition of being primarily health related to really being medical interventions, to now considering items that follow the following three rules: that it diagnoses, treats, or prevents illness or injury, or compensates for physical impairments, is the first one. The next, and this is a common term that CMS has used in the definition of the expanded health benefits, is to ameliorate or ease or assist with functional or psychological impacts of an injury or health conditions. Or the third thing is to reduce avoidable emergency and healthcare utilization. So it broadened the term to not just have to be a medical intervention directly. But it does not include items or services that are solely or primarily for things such as comfort, cosmetic benefits, general use, or even social determinants of health. And in terms of social determinants of health, those are things like access to healthy foods, or having support systems in place, those type of things, or what your social determinants are, fall into that category. So if it's just purely for those type of things, it is not going to be covered by this new expansion in 2019. The expanded definition, though, really focuses on the enrollees' total healthcare needs. So it still is looking at healthcare. They generally have to be recommended by a medical professional as part of the care plan, but are not required to have a physician's order. Just as a side note, we don't know quite what that looks like yet in terms of what it means to have to be recommended as part of a care plan by a licensed medical professional, what documentation will be required, and those type of things. But that is part of the expanded definition, is that for these services to be covered, they do have to be recommended. And then the last thing is the plans that are offering any of these expanded supplemental health related benefits, they have to be spelled out very clearly in what will be covered in the plan and what will not be covered in the plans. So this is the important point, is with over 2,300 plans just in 2017, each Medicare Advantage organization or managed care organization has the choice to choose what benefits they include or not. And so they must define those, and it must be approved by the Center for Medicare and Medicaid Services. So in terms of those newly allowable supplemental health-related benefits for 2019, I'll walk through each one. The first is actually now covering adult day services. So this is where somebody may attend go to a facility, go to a center, and receive assistance or education to support with their activities of daily living or instrumental activities of daily living, or that it's helping maintain or rehabilitate, as well as providing some social services. Just as a quick reference, because I don't like to use acronyms, but I did for sake of space, when we refer to activities of daily living or instrumental activities of daily living, those are truly those activities, and they tend to be consistently defined under activities of daily living, things like dressing, bathing, grooming, toileting, ambulation, transfers, those very basics of being able to function throughout the day. And your instrumental activities of daily living are a little bit higher functioning, require more executive skills, if you will. to be able to execute, but can often be early indicators of either functional or cognitive decline before their actual activities of daily living are impacted. So those instrumental activities of daily living are things like housekeeping, managing finances, utilization of the telephone, meal preparation. So gives you an idea of what are covered under those. So under the adult day services, because I'll refer to those activities of daily living and instrumental activities of daily living again. So under adult day services, that's where, again, somebody would attend go to a center and have that assistance with those activities of daily living or instrumental activities of daily living, having support with them, rehabilitation. What's interesting is that also transportation to and from the adult day services, as well as any recreational or social activities that might be included, as well as meals that are ancillary to care, will be covered. It can't be that you're going just to have socialization or that you just need a ride to or from a place, but if they are part of the overall care plan that covers things like your activities of daily living, those other services can be covered as part of the total package. This must be offered by staff that meet all state licensing requirements for adult day services. So can't just be someone down the street decides to help a couple of adult dependents. They have to be licensed to be able to provide it. So the next offering that is now allowable under the supplemental benefits expanded definition is home-based palliative care. So this is our services that are being offered to diminish symptoms of terminally ill beneficiaries, pardon me, but are for those that have a life expectancy greater than 6 months. So it's therefore not covering the area that's covered by the hospice benefit currently as part of the Medicare. So hospice is already covered. So this gives another benefit for those individuals that are expected to have a life expectancy based on normal progression of the disease state of greater than 6 months. The next benefit that you'll see here is the in-home support services. So this is actually helping those beneficiaries with performing those activities of daily living or instrumental activities of daily living that I just discussed, or being able to help with the functional impact of an illness or injury, activities that will help avoid emergency department or healthcare utilization, and this must be provided by state or consistent with state regulations. And just as a side note, this was the greatest amount of detail they provided, was that really services that support the overall expanded definition. So they didn't detail anything more of what those services look like, but these are your typical in-home services when you hear people referring to personal care or companion care. So companion care can't just be alone in itself a benefit, since that's comfort, social determinants, etc. The next one is actually support for the family caregivers of the enrollees. It can be actually providing care as a break for the caregiver, or otherwise known as respite care. They did say, outline it as for a short time, and they said that short time might be from a couple of days to a couple of weeks, but not extended beyond that. And then also under this benefit is counseling and training for caregivers, which I think is just excellent. The next allowable supplemental health-related benefit is medically approved non-opioid pain management. So I'm sure that everybody has heard in the news everything going on around the opioid crisis. So this is speaking directly to it as how can we manage pain outside of the use of opioids. And it can be pain treatment such as therapeutic massage is an example they gave specifically. And with that therapeutic massage specifically, this is the only place where they indicated that it have to have physician's orders to indicate that is specifically health related. Because again, since the benefits don't cover comfort or ease, it can't just be that it helps with soreness. It would have to be for pain related to illness or injury. Next additional benefit is the standalone memory fitness benefit. There's actually a memory fitness benefit that's already included as part of it, but this now allows it to be standalone, so not just part of the health education benefit that it's currently a part of. So now it can be standalone, and this is primarily for the prevention, treatment, or amelioration of that functional or psychological impact of illness or injury. The next one, which is a pretty big change and could impact a lot of the individuals that we as senior certified advisors support, is the home and bathroom safety devices and modifications. So there's some modifications and equipment, if you will, that already is covered by Medicare. So this is expanding it for things that are not currently covered by Medicare, that are safety devices to prevent injury in the home or bathroom, which I always find it funny that the home is usually in the bathroom, or the bathroom is usually in the home, but these types of things would be, as you can see listed here, shower stools, handheld showers, rails or grab bars, raised toilet seats, and temporary or portable ramps, not permanent ramps, night lights or stair tread. So things that can, obviously help the beneficiary be safer in home. It also can include the cost of installation as well as the inspections conducted by a qualified health professional to understand what the need is specific to the home. And by the way, the individuals that are qualified to do those inspections have to be in compliance with state and federal requirements that are already outlined. This benefit, however, does not cover any capital or structural improvements. And I gave the example here such as hall widening. They also specifically outline permanent ramps or things that are more generically safety related, such as smoke detectors or fire alarms, because that's not specific to illness or injury. Another very interesting benefit that's now outlined with part of the expansion is transportation. And this is transportation that is non-emergent, so it's not now covering the portion of, let's say, an ambulance ride that's not currently covered. This is non-emergent transportation specifically to get to and from medical services. So it can't be things, even though it might help them in terms of being able to stay healthy and well, is to get to the grocery store. It's not currently covering getting to grocery shopping or getting to banking. It is truly for the provision of medical services. But what's neat is it can include having a health aid as part of the transportation. So going along with the beneficiary to help get in and safely in and out of the transportation and in and out of their appointment. And then there is an over-the-counter benefit that's also been added. So in addition to the medications that are already covered, so it's not covering the ones that are already offered under Part A, B, or D, these are additional medications, but also includes some assistive devices such as pill cutters, pill bottle openers, those type of things that can really impact our elders and whether or not they're able to access the medications that they've been provided. So those are all the new benefits that are outlined as part of the 2019 changes. So I mentioned also that there were changes that will be coming in calendar year 2020. We don't know a lot about it. Guidance on this is very much still pending. But what changed is instead of just expanding the definition of health-related benefits, it actually just kind of expanded supplemental benefits to be anything that would have a reasonable expectation of improving or maintaining health or overall well-being for those that are chronically ill. And so unlike the expanded definition for 2019, which all of those benefits have to be related specific to a condition or injury, it can't be generically, this is, it will help with activities of daily living. There has to be a diagnosis or care plan that's specifically being addressed. For 2020, it's not saying it has to be specific to condition or injury, although it is for chronically ill, so there will have to be some point in which they're identifying who's chronically ill. and and there is anticipation that it is likely to address the social determinants of health, such as access to healthy food, or support services that are more generic than actually helping with their activities of daily living. And that's because social determinants of health have been determined to be the #1 indicator for outcome and cost. And so there's anticipation of that, but there's still, like as it says here, and as I mentioned earlier, still a lot pending. So we don't know ultimately what will be included. So how does this all impact the availability, not availability, sorry for the typo, the availability of the expanded supplemental benefits in 2019? Well, everything that we're hearing through the wires, through the news outlets, is that it's expected that approaching these benefits or offering them as part of the Medicare Advantage plans is expected to be tentative. The reason for that is that it's really difficult to understand what the plan's actual costs will be, and therefore what portion they would expect the beneficiary to have cost sharing or some sort of related cost. Those cost sharings come in the form of potential premiums, which they don't tend to like to offer, or how the co-pay or co-insurance is built in. And they have to know the costs and the cost sharing in order to put in their bids to be approved by CMS. And so those bids were due in June. And so we still have yet to hear what specific plans are being offered. There's anticipation that this might be tested in limited markets or plans to see what those costs ultimately end up being, as well as the impact. Can they see, or will we see the return on the investment in these types of support services, or these, expanded definition services that are anticipated, but they still don't know, again, what the results will be. And then to complicate things further is, all of these unknowns for 2019 is that, of course, there is those proposed changes for 2020. And so there's some anticipation that a lot of plans won't include benefits or these additional supplemental health related benefits in 2019, because they're going to wait to see what the 2020 changes might bring, since some of them may seem at conflict with each other, or it would just require rewriting. Also, what we absolutely don't know is any of the pricing that is going to come along with it. So how much would the adult day services be reimbursed at, or how much would it cost the beneficiary? Or in the case of my company, how much in-home care support services would be covered. We have no information on that so far, but hopefully that will be coming soon. There's anticipation that it should be coming quickly. And we do anticipate, the last bullet here that you'll see, we do anticipate that some of the managed care organizations might be more apt to do some testing in the markets, because they actually have providers such as in-home care or transportation as part of their overall portfolio of services. So as an example, Humana has an in-home care, services, as well as some in-home physician support services. So we anticipate that we will see some plans from those organizations that can cover some of the benefits. So what can you do? Well, the first thing is really understanding if your seniors or the elders that you support today are enrolled in Medicare Advantage plans. So again, this is not just if they have Medicare. You have to find out whether or not they are traditional or original Medicare or Medicare Advantage. The way that you can tell is usually they'll have the name of the managed care organization or Medicare Advantage organization that oversees it, such as Humana, United, Blue Cross Blue Shield, Anthem, etc. On their card or as part of their plan. Their cards usually look a little bit different than the traditional Medicare card. And if so, you'll want to start understanding which benefits might be offered specific to their plan. Like I said, that information isn't available today, so your beneficiaries may not know yet. But beginning to understand who has a Medicare Advantage plan will help be able to have conversations about what services or items that may be covered. So I will pause for a second, and I believe that Jeff may have some questions for us.
Yes, absolutely. Thank you so much, Jennifer. That was great. And yes, there's just a few questions. I'll go ahead and start. Let's see, are these supplemental benefits a part of a Medicare Advantage plan? Seems that this would almost eliminate long-term care policy.
So yes, they would be covered as part of a Medicare Advantage plan, assuming the Medicare Advantage organizations want to offer them as part of the plan. In terms of being able to, if they would substitute for long-term care insurance, it's not clear that that would necessarily be the case because long-term care insurance has some different requirements, but there may be some that would be covered that wasn't previously covered, where I guess the services or eligibility would overlap, but it is not a substitute for long-term care insurance.
All right. Next one is Part C does not cover Part D.
Nope, Part C does cover Part D. So Part C has a Medicare Advantage plan or Part C plan. It has to cover all of the services or benefits that are covered under Parts A, B, and D. You'll find some specialty plans that don't have a Part D, which is the prescription benefit, but those are not true Medicare Advantage plans.
All right. Is adult day benefit only for an adult day facility or program, or could it be used to care in the patient's home?
From what can be told, what we can tell based on the guidelines provided, that it has to be by staff that meet the state requirements for adult day services, is that this is not intended for reimbursement of adult dependent care in the home. And those services probably would be more covered under the in-home support services. So the adult day is, it doesn't say that it has to be specifically in a facility or a center, but as far as we can tell, it's directing that way, that you can't just start it, an adult day in your own home and call it a day.
Okay, all right, that makes sense. All right, the next one is, it's a kind of a situational question. Does this mean that only patients that have been diagnosed with not being able to perform ADLs qualify for this? How about somebody that is 96 and just needs help with remembering and stuff around the house, but has not been diagnosed with anything except what comes along with being 96?
Yeah, that's a great question. So again, from what we can tell, and there's a lot of, the guidance is still pretty broad, is that it is specific to illness or injury. So unless there were a specific illness or injury, they likely wouldn't be covered. But I would want to see, when we have to see which plans are being offered, what that really looks like and further guidance from CMS.
Okay. All right. Is there a time frame on the length of time the supplemental benefits can be paid?
We don't know that information yet. We have no guidance on not just pricing, but how it will be priced. So, as an example, in my space for home care, we don't know if it will cover a certain number of hours for a certain number of time or a certain number of days, and certainly not at whatever price. So we have no information as of yet what the plans have proposed in terms of actual coverage, either in cost or time.
Okay. All right. Let's see. Where does extra therapy fall in? Like licensed music therapy? Is that included by Medicare?
As far as what they've outlined, it does not look like that's included. If somehow it could be documented as being a non-opioid therapeutic pain intervention, maybe, but unfortunately, it's not just all benefits that are covered. They are still pretty specific to illness or injury.
Gotcha. All right. That makes sense. Let's see, will home care agencies have to bill Medicare directly, or will the patient pay us directly and get reimbursed from Medicare?
It is most likely that you'll bill the Medicare Advantage organization. So you wouldn't be billing CMS, you'd be billing the Humana's, United's, Blue Cross Blue Shield, etc. And you would get paid directly.
Okay, all right. Let's see, would home care companies have to be Medicare certified to be reimbursed, or would it be more like a long-term care submission?
Great question. Everything that has been indicated so far is that anyone providing services under the health-related supplemental benefits would not require to be Medicare certified, because the providers today that are under the current definition, such as those dental, vision, hearing, those currently don't have to be a Medicare certified provider, but there are things such as probably you'll most likely have to have a national provider ID and some of that information. But so far, every indication is that you will not have to be Medicare certified, since we don't fall under the traditional Medicare benefits.
Gotcha. Okay. And this kind of piggybacks off of that last question. If you are a provider, how do you go about getting approved with the insurers?
Well, that is yet to be seen, but we believe it will follow the same patterns that current providers of those, again, the health-related supplemental benefits such as vision, dental, etc. And they have provider enrollment opportunities where you submit your paperwork, make sure you follow whatever requirements that they have. But I didn't speak about this earlier, but Medicare Advantage are actually mostly HMOs and PPOs. So it's just like becoming an in-provider network for an HMO or a PPO. If you're a doctor, you would do the same. Obviously, the requirements for what you have to do is going to be different, but you would become a in-network provider.
Gotcha. Okay, that makes sense. And how do you think this will affect the long-term care insurance industry?
Oh, I would be scared to predict that.
All right.
Too many factors to go into that one.
Exactly. All right. Let's see here. Since Medicare and Medicaid has an emphasis on freedom of choice, what does this mean for this? It sounded like Advantage plans will dictate who they have to choose these benefits.
Yeah, so great question. So I mentioned that they function like HMOs and PPOs. So you'd have choices of providers that are in network, and you could still choose to go out of network, just at a different cost. So patients will still have choice, but it will be choice based on whether they're in network or not, just like you do with a doctor today.
Oh, gotcha. Okay, that makes sense. All right. When is CMS going to issue more guidance on these benefits, or on this benefit?
Well, we've heard that there will be more guidance coming out at the end of July.
Okay, so pretty soon.
Hopefully.
All right. Let's see. The next one. What is the role of TRICARE? Will it participate?
I don't know.
Okay.
I don't have that information.
Okay. Let's see. This sounds a little bit like a situational question. If you are enrolled in Medicare C, can you later switch to B and D?
I don't know the answer to that question. I believe you can, but I'm not sure.
Okay. All right. And we got one more question here. Do you think this will eventually move out of general Medicare, or do you think it is a way for people to force people into Medicare Advantage plans which are basically HMOs?
Yeah, it's complete speculation to say this, but there's a lot of, at least our industry, that was disappointed that it was specific to Medicare Advantage, because it means that it wouldn't be incorporated into Medicare. But other things have historically rolled over and become a benefit. So just not sure. We hope that the data proves out that it impacts costs and outcomes strongly enough to have these additional benefits that it would make sense to offer to every Medicare beneficiary. But that's kind of a crystal ball. We're not quite sure.
Gotcha. All right. So yeah, I believe that's all the questions we had, and thanks everyone for joining us. Just to mention that all these CSA monthly webinars are available on csa.us/events, and they're free for everyone, especially if you're a CSA. You get a chance to earn 1 CE credit per webinar. Jen, thank you so much for giving this wonderful presentation, and we will look forward to seeing you at our conference in Dallas coming up on August 26th or 24th through the 26th. Thanks again, Jen. It was a pleasure.
Thank you, Jeff.